alcohol. It's at every celebration, every funeral reception, every first date, and every difficult Tuesday night. It's woven into the fabric of how we socialize, how we grieve, how we celebrate, and how we cope. But here's the question we rarely stop to ask. What does the science actually say about it? Not the marketing, not the cultural mythology, not your uncle's opinion at Thanksgiving, the actual peer-reviewed published science. Today, we're going to go through 3 areas: the social dynamics of drinking, the question of whether alcohol has any genuine health benefits, and the hard data on what it does to your body. And I'll try to be honest with you the whole way through, because this is a topic that deserves honesty. But before we get into the research, I want to tell you a little bit about why this topic matters to me personally. So for the entirety of my 20s, I was in a band. While in that band, we played concerts at all different types of venues, with the majority of them being some sort of bar. Looking back on nearly every photo from that time period, and well, even now, I have a drink in my hand. Now this makes some amount of sense because the photos are usually taken at social events, and most social events have drinks. And for most of my life, my health was fine. But as I crossed over into my 40s, I started to notice that my weight and body fat wouldn't go down even when I was being strict with my exercise. I was eating relatively healthy, but if you take a look at graphs of my sleep quality as measured by my Garmin watch, you can see a pattern emerge. Nights where I drank, my subsequent sleep score was pretty terrible. So this raised a few questions in my mind. But let's dig in. Let's start with just how embedded alcohol is in American culture. We're not talking about a fringe behavior. According to the 2023 National Survey on Drug Use and Health, 68% of American adults over the age of 21 drink alcohol. That's 2 out of 3 adults. So when we talk about alcohol, we're talking about something most of us are navigating, whether we drink ourselves or whether we're in a world where everyone around us does. Here's one of the most fascinating findings I came across. Researchers at Nature's Scientific Reports used longitudinal data from the famous Framingham Heart Study, one of the longest-running health studies ever conducted, to look at how alcohol behavior spreads through social networks, and what they found was striking. For every heavy drinker or abstainer in your social circle, your own probability of shifting your drinking behavior in that direction increases by 40%. Think about what that means. Your drinking habits and your decision to stop drinking aren't formed in a vacuum. They're shaped in measurable ways by the people you spend time with. This is what researchers call social contagion, which honestly feels like a bit of a loaded term. It applies to smoking, it applies to obesity, and it applies to alcohol. The social dimension is especially powerful for younger people. Research consistently shows that young adults drink more when they're in groups than when they drink alone. But there's a new layer to this: social media. A 2024 systematic review and meta-analysis looked at 30 studies examining how alcohol-related content on social media affects youth drinking. The findings were consistent across the data. Greater exposure to alcohol content on social media predicted greater future alcohol consumption in young people. And self-posting about alcohol was also independently linked to drinking more. The mechanism here isn't mysterious. Social media creates what researchers call normative expectancies, the sense that everyone does this. When a teenager sees alcohol on their feed constantly, drinking stops looking like a choice and starts looking like a default. Now, there's a noticeable counter-trend happening right now: the so-called sober curious movement. The idea of consciously examining your relationship with alcohol rather than drinking by default has gained real momentum, particularly among younger Americans. The NIAAA, National Institute on Alcohol Abuse and Alcoholism, which again feels like a loaded term, has noted that these movements, along with Dry January and Sober October campaigns, have helped create what their director called, quote, a cultural space for exploring and changing drinking behavior. So the social forces around alcohol aren't monolithic. They're pulling in multiple directions at once, which is actually a reason to be more intentional about which direction you let them pull you. Before we move on, one more finding worth knowing: your zip code and income level matter too. A 2024 study analyzing data from 2.3 million people in Sweden found that lower income and lower education independently associated with a higher likelihood of developing alcohol-related medical conditions, even after controlling for how much people actually drank. The harm of alcohol doesn't fall evenly across society. Are there any benefits? So, for decades there was a comforting narrative in medicine that moderate drinking, a glass of red wine with dinner, was not just harmless but potentially protective. Lower heart disease risk, lower diabetes risk, maybe even a longer life. This wasn't just folk wisdom. It was backed by real studies, some of them large and well-regarded. The data consistently showed what researchers called a J-curve, where moderate drinkers had better health outcomes than both heavy drinkers and total abstainers. For example, a 2023 meta-analysis found that compared to lifetime non-drinkers, Light to moderate drinkers had a 23% lower risk of all-cause mortality and a 24% lower risk of dying from cardiovascular disease. Those are significant numbers, and the biological explanation seemed plausible. Alcohol raises HDL cholesterol, the good cholesterol, reduces inflammation, and affects blood clotting in ways that could be cardioprotective at low doses. But here's the problem. And this one's important to understand because it gets to the heart of how research can mislead us even when the studies are conducted in good faith. Those earlier studies had a fundamental flaw called abstainer bias. When researchers compared moderate drinkers to non-drinkers, the non-drinker category included a lot of people who had quit drinking because they were already sick, former alcoholics with liver damage, people who gave up alcohol after a heart attack, people who stopped because their doctor told them to. So, of course, moderate drinkers looked healthier by comparison. The comparison group was skewed towards the already ill. When researchers corrected for this using lifetime abstainers as the true comparison group and applying more sophisticated causal methods, the apparent benefits largely disappeared or shrank dramatically. A 2024 critical review published in the journal Alcohol, Clinical, and Experimental Research concluded traditional observational studies substantially overestimated the protective benefits of moderate drinking and underestimated the harms of heavier consumption. Stanford Medicine researchers have gone further. In a 2025 report, experts who study alcohol from the angles of addiction, chronic disease, and molecular science reached a common conclusion. The idea that moderate, occasional drinking is good for your health, their words, is outdated. A 2024 JAMA study that followed more than 135,000 drinkers over age 60 found that even moderate alcohol intake was associated with a higher death rate, with much of that increase tied to cancer and cardiovascular disease. So, where does this leave us? Here's my honest read of the current science. There may be a narrow window, particularly for older adults in relation to cardiovascular disease specifically, where very light drinking is not clearly harmful. Some studies still find this signal, but it is much weaker than we thought. It likely does not extend to cancer risk at all and is almost certainly outweighed by younger populations. The Lancet put it well in a 2023 analysis: the absolute risk of light to moderate drinking are small, and it may be reasonable that the quality of life someone gains from an occasional drink is deemed greater than the potential harm. But, and this is critical, that it is a personal choice to make with clear eyes, not a medical endorsement. If you were hoping I'd tell you that a glass of wine at night is good for your heart, I understand. I was kind of hoping to find that out too, but the most current science does not support it. In January 2025, the US Surgeon General issued a formal advisory, something that happens rarely, reserved for the most serious public health concerns. The message was about alcohol and cancer. The advisory called for updated warning labels on all alcoholic beverage containers. Here's what those labels would say. Drinking alcohol increases your risk of at least 7 types of cancer, including breast, colon, liver, oral, cavity, esophagus, larynx, and pharynx. Now, cancer warning labels on alcohol would be a historic shift. Alcohol has been sold without them for decades. This advisory signals just how much the scientific consensus has moved. Here's the trajectory. Researchers at the Sylvester Comprehensive Cancer Center at the University of Miami analyzed data from the Global Burden of Disease database and presented their findings at the American Society of Clinical Oncology conference in 2025. Between 1990 and 2021, total alcohol-related cancer deaths in the United States nearly doubled from just under 12,000 per year to over 23,000 per year. Liver cancer, colorectal cancer, and esophageal cancer saw the steepest rises. And the burden has been growing most sharply in men over 55, with alcohol-linked cancer mortality rising by 1% each year in that group between 2007 and 2021. For a long time, skeptics could argue that these were just correlations, that alcohol drinkers might have other unhealthy behaviors driving cancer rate. But we now have much stronger causal methods to test this. A landmark 2024 systematic review published in Frontiers in Epidemiology analyzed 70 Mendelian randomization studies, a sophisticated genetic methodology designed specifically to tease out causation rather than correlation. It covered research from 2000 through May 2024. The conclusion? Alcohol consumption has a confirmed causal association with oral, oropharyngeal, esophageal, colorectal cancers, and liver cancer. It also has a likely causal effect on hypertension, atrial fibrillation, and myocardial infarction. Cancer aside, alcohol's relationship with the liver is perhaps its most well-established and serious health consequence. The federal government's own draft health study, released for public comment in 2025 by SAMHSA, put it starkly. At 2 drinks per day, liver cirrhosis risk rises more than 5 times that of non-drinkers. At 3 drinks per day, it rises more than 10 times. And to be clear on what 2 drinks a day means, That is currently within the US Dietary Guidelines definition of moderate drinking for men. So we're not talking about heavy drinking here. We're talking about what many people would call normal. The health impact of alcohol also extends well beyond individual disease risk. Alcohol is a major driver of acute harm. According to the SAMHSA data, alcohol contributes each year to 599,000 unintentional injuries, 97,000 sexual assault cases, 696,000 physical assaults, and over 3.3 million incidents of driving under the influence. Finally, and I think this one is one of the more important and underreported dimensions of this conversation, the harms of alcohol do not fall equal. A 2025 systematic review found that the cancer burden from alcohol is disproportionately borne by African Americans, people with genetic predispositions, and individuals with obesity or diabetes. Lower socioeconomic communities experience greater harm even at similar levels of consumption because of differences in access to healthcare, stress load, and other compounding risk factors. Alcohol is not an equal opportunity risk, and any honest conversation about this has to acknowledge that first. So where does all of this leave us? I'm not here to tell you what to do. The data doesn't demand total abstinence for everyone. It demands that we make these decisions with actual information, not mythology handed to us by an industry that spent decades telling us a glass of wine was self-care. What the research shows us is this: alcohol is a social drug, deeply shaped by our environments and the people around us. Its proposed health benefits have been largely overstated and are now being walked back by serious researchers. And its risks, especially for cancer and liver disease, are real, causal, and growing. None of that means a drink at a wedding will kill you. Context, quantity, and individual biology all matter enormously. But it does mean that the question deserves to be asked, honestly, without flinching, which is exactly what I started doing when I started asking for myself. And whatever your relationship with alcohol looks like right now, I hope this gives you something useful to think with. Thanks for watching. If this resonated with you, share it with someone that it might help. And as always, I'll see you on the next one.